Okay, so this is the wall supported reach exercise. You're going to get 1 foot distance away from the wall. So you're gonna measure it out and then you're gonna go about hip width apart. You're gonna get a bolster about this size, something a little squishy. You're gonna place that in between your knees and you're gonna start on the wall. You'll notice there's a little gap in your low back. So what you're gonna do is you're just going to do a little bit of a quarter squat. That should get the gap like about 80% eliminated. And then from here, what you're gonna do is you're gonna get a posterior pelvic tilt by tucking your tailbone underneath you. What that will do is get the tailbone peeled off the wall. Your low back and your lower ribs are going to be glued against the wall. So a cue I like to give is from the bra line to the belt line, you should be on the wall. All right, from here, you're going to point your hands towards the floor. You're going to inhale through your nose, nice and quiet, without engaging your neck and your traps. So, like so. Exhale, blow all the air out through pursed lips. You're going to maintain this reach. You're not gonna lift up when you inhale. You're gonna maintain the forward flexed position. You're gonna inhale through your nose and feel expansion in your upper back right here. Exhale all the way. Inhale, feel expansion in your upper back. Exhale. We're gonna try to reach a little bit more. It'll just be like a couple millimeters, centimeters at a time, but you're gonna let the exhale drive these ribs down, your side abs turn on. Let the exhale have you reach forward, not you reaching forward with your pecs, right? We don't want tight pecs to help you reach forward. We want the exhalation and these ribs coming down to bring that crunching forward and the reaching forward, right? As you reach forward, your lower ribs are gonna wanna come off. Your goal is to keep those ribs tucked back towards the wall and exhale and reach, having that fine tension between reaching and pushing back with your ribs. Tailbone tucked. And here, what you'll notice, right, is after you do 1 or 2 breaths, you'll notice all the pressure on your toes. What I want you to do is also be mindful of relieving that pressure on your toes and going into your heels. When you go into your heels, you'll find that tucking your rib cage and tucking your pelvis underneath you is going to be a lot easier. As you inhale and exhale and go into another repetition, you'll notice that the pressure tends to divert to your toes. Be aware of that and just bring it back to the heels. The more you practice this, the more you'll be able to keep that reference of your heels and the reference of your low back and especially your lower ribs against the wall. Let me know how it goes.